With Mr. Phillipson. Hello. Good morning, Mr. Phillipson. Hello, sir.
Yes.
Good morning. Yes, we hear you from Bilbao.
Morning.
I
It's a
just
pleasure to be
introduced
here.
you, so I give you the floor. Si
I give you
quiere,
the
ya
yeah.
le damos la palabra.
And you have the floor because we've just introduced you and we want to listen to what you have to say as regards this recovery plan that you want to present for age-friendly communities in this context of COVID-19. So go ahead, sir, please.
Well, it's a great pleasure to present your comments, which I think is really extraordinary. One of the urgent issues in the age-friendly movement at the present time. If we could go on to the first slide. If I could, in areas which I cover, to explore the background to the debate on age-friendly communities, some of the policy issues influencing the urban agenda on age-friendly issues, some of the achievements of the age-friendly movement, and look at some of the challenges in relation to the issues posed by COVID-19, which are clearly raising a lot of important questions for us. And then I also want to develop what I think might be some kind of recovery planning strategy. So in terms of the growth of the movement, I think we've had an extraordinary surge of interest in developing age-friendly cities and communities. From the launch of the global network of age-friendly cities in 2010, we now have around 1,000 members, of course, and this is an extraordinary achievement, and I'd certainly want to pay tribute to the work in the Basque Country, where we have an extraordinary level of activity, and I think this is so important at the present time, given the pressures upon us. So what are the debates that have been influencing the movement? I think that age-friendly movement has emerged out of a whole range of discussions, and it's important to recognize these. First, we've had a discussion about building sustainable cities, sustainable communities that can meet the needs of current and future generations. Secondly, we've had an important intervention by the United Nations on how we achieve social justice in the city, or the idea of harmonious cities, harmonious communities. And thirdly, problems in relation to developing more unequal, the development of unequal cities, which has become a big issue, I think, for Spain, for the Basque Country, and for the UK, in terms of how we reduce the health and income gap between neighbourhoods. And of course, we've also had the development of this policy of ageing in place, the idea that older people would prefer to live in the communities which they've spent the majority of their lives, and the idea of trying to develop lifetime homes and neighbourhoods. What are some of the achievements of the age-friendly movement? I would probably single out four which have been important. I think, firstly, greater recognition in planning, regional planning and town planning, of the implications of population aging. Secondly, the development, particularly important, of course, in the Basque region, of organisations and networks at regional and local government levels. And you have now, I think, 65 municipalities involved in developing age-friendly issues. So this is an extraordinary achievement. Thirdly, interventions supporting the empowerment of older people at a neighbourhood level. I think a really significant discussion here about how we give different groups of older people greater control within their localities. And finally, the importance and issues which I know have been important in the Basque region, campaigns around ageism and intergenerational solidarity. But on the other hand, I think it's clear that COVID-19 is raising a significant challenge for the age-friendly movement. And for a number of reasons, we have evidence for increasing inequality between poorer and wealthier neighbourhoods. And in the case of England, I should just note that people in poorest communities have been dying at twice the rate of COVID-19 as those in richer areas. And of course, all of this has followed on the austerity policies following 2008 financial crisis, which cut many of the key services necessary for tackling the pandemic: health personnel, public health, nursing home care. So we've had austerity for a number of years, and COVID coming on top of that. And this has been a problem for both of our societies, both of our regions. Greater Manchester hit very hard by austerity policies. So I think this is, one of the big challenges that that we faced. Thirdly, we've had, unfortunately, the rise of ageism in the context of COVID-19. And I know this has been the subject of studies in your own area. And we've certainly seen it in the UK. And I'll come back to this point. And finally, a disturbing rise of violence against women by male partners. Of course, this is true across all age groups. But I think it has been an area of great concern in the UK of women trapped in their homes and subjected to abuse at higher levels because of the restrictions posed by COVID-19. So I think in this context, we have to look at how we develop a strategy for recovering over the medium term, at least, from the challenges posed by COVID-19. And I've highlighted four areas here: developing community support, combating ageism and discrimination. Thirdly, developing an age-friendly strategy for nursing and residential homes, and finally planning for the future. Some suggestions there. So on the first of these, I think we're looking, certainly in the UK, we're looking at the importance of extra funding for the poorest communities to combat the effects of COVID-19. There's no question, and I'm sure this is true in the Basque region as well, that it is the poorest areas that have suffered the most in terms of mortality, in terms of general crisis of health and finances from the effects of COVID-19. We've had, I think in response to this, I think we do need to look at the models of neighbourhood working at a local level. Can we strengthen organisations at a local level? I think, cooperatives, people coming together, supporting each other over different issues is one way of thinking about this. And again, I know that's an area that is of interest in the Basque region. Thirdly, we do talk a lot, certainly in the UK, of the idea of co-research by older people themselves, older people working alongside researchers, academics, to identify issues and concerns within their community. I think then we also need to think about community leadership. The impact of COVID-19 and social distancing has been to fragment communities, I think, in different ways, certainly to fragment generations and cause potential divisions within generations. So looking at the idea of community leadership, I think, is particularly important. And finally, in urban areas, again, one of the debates we're having is how you strengthen ties between big institutions, what we call anchor institutions, universities are an example, and low-income neighbourhoods. So perhaps using the resources of universities, not only their research, but the income that they have, to work with and support in different ways the neighbourhoods which they are surrounding them. Second area I think we have to include in our recovery is the issue of ageism and discrimination. And here I think we have had evidence for the rise of ageism with COVID-19 and older people presented as a increasingly as a burden and cost to society. It is also the case, I think, that the pandemic has increased difficulties of those in minority and LGBTQ communities. We've seen some evidence in the UK of greater pressure on those communities in the context of COVID-19. So I think I would make 3 points here. Firstly, that the age-friendly movement needs to link with equalities organisations to ensure that the work that we're doing to recover from COVID-19 is responding to intersecting issues of ageism, racism, and sexism. Secondly, I think elder abuse does need to have a more prominent focus in age-friendly work. Again, I know this has been a big issue and big area of research, but the concern is that its prevalence may be increasing given pressures on families and communities. We really don't know enough about this, and I think I would urge some attention to this question at the present time. And certainly extending work strengthening intergenerational ties. Again, I know this has been a feature of work amongst many of your municipalities. And it seems to me at the present moment that it's become even more important. Thirdly, a third arm of my recovery plan is in relation to nursing and residential care, where, of course, 30 to 40% of deaths have occurred in residential and nursing homes in many European countries. This has certainly been a big issue in the UK, and I think we have to face up to the real challenges which older people have in this institutional context. So we need, I think, first to incorporate care homes into age-friendly planning and activities. Historically, I don't think we've really done this. Age-friendly work has tended to operate outside residential nursing home sector. I think we need to be thinking about how we develop new models of residential care. It's clear that, particularly for those diagnosed with dementia, it's clear that existing types of residential and nursing homes have been a real issue in terms of COVID-19. The evidence in particular is that the large homes have had a higher mortality rate than smaller homes. So we need to look at that. But I think look generally at the type of support we provide for those who are especially frail, who have cognitive difficulties of various kinds. We, of course, need to transform the pay and conditions of those working in care homes. The COVID crisis has thrown a spotlight on what is really the exploitation of women working in homes, often poorly trained and doing as best job as they can, but really challenged in the context of COVID-19. And we need to protect the rights of residents of care homes. And we've had a report from Amnesty International in the UK on this issue, that the rights of people in care homes have actually been neglected severely. And this is shown up by the COVID crisis. I think finally, planning for the future. And I've identified 5 areas here. I think we do need an age-friendly strategy which responds to the likely medium-term continuation of social distancing. The reality is that really over the next 2-3 years, we may have to continue the kind of relationships that have emerged to protect ourselves from the spread of the virus. There's no quick fix on offer. And thinking about the implications of that for age-friendly work seems to me extremely important. Secondly, the age-friendly movement will need to collaborate with other organisations working in areas such as healthy cities, smart cities, and around climate change, which is affecting us all, of course. We need a stronger age-friendly movement, and I think that will only come with linking up with these other organisations. There's a worry that new inequalities may emerge as COVID-19 continues. Digital exclusion is one obvious one. Some groups of older people who may be less familiar with technology will experience inequality as a result. But more optimistically, it may be that new solidarities may also emerge with the rise of mutual aid, cooperatives, improved relationships within neighbourhoods. So we may have a more a society where there is more cooperation, more solidarity as a result of having to fight the virus. And finally, I think developing research collaborations is very important. And I think trying to link up research institutes, I would certainly encourage that, and joint projects, comparative projects, comparing the experiences between, say, Greater Manchester and municipalities in the Basque region would be, I think, very exciting. Finally, just some questions for the age-friendly movement and to start a debate. And I've just identified 4 here. First, can the age-friendly movement be part of the drive to address issues of inequalities in social justice and rights affecting urban life? We do have seen the upsurge of inequality in various forms in different communities, and I think the age-friendly movement needs to think about how it addresses those. Post-COVID, can older people play a bigger role in the future planning of cities and regions and the communities within them? That, I think, should be a big concern for us. Thirdly, can the age-friendly movement play a leadership role in challenging the impact of ageism, helping to bring different generations together? And finally, can the age-friendly movement contribute to the debate about what kind of post-COVID society we want to rebuild or recover? I think society cannot go back to what it had been previously. We do need to think about a more equal, solidaristic society, and the age-friendly movement, I think, could make a great contribution to that. Well, it's been a great honor for me to present at this conference, and I look forward to any responses or issues to the questions raised.